This is Kyle Jones from Richmond News, 8 on your side, to discuss an international right-to-life controversy surrounding a Canadian infant by the name of Baby Joseph. Baby Joseph was born on January 22, 2010, and was developing as expected until the age of 3 months, when his parents noticed he couldn't eat or breathe properly and wouldn't open his eyes or cry. One unfortunate day brought a devastating diagnosis. Joseph was rushed to a Michigan hospital where he was diagnosed with a metabolic brain disease, which unfortunately was all too familiar to this family, as their firstborn daughter was also diagnosed with the same disease 8 years ago. Fortunately, Joseph was discharged from the hospital and was showing signs of improvement until October of 2010. Joseph once again stopped breathing. He was rushed to an emergency room in Ingersoll and later transferred to the London Health Sciences Centre in London, Canada, where we have our correspondent, Tanya Delvegado, who is with an LHSC representative to discuss the case of Baby Joseph. Before we go to Tanya, I want to give you 3 questions to think about. What would you do if Joseph was your child? If the U.S. had a socialized healthcare system, would citizens be forced to look outside the borders to seek out life-sustaining treatment? Lastly, who makes the final say, and who gets to decide what services and for what reason? And with that, let's send it over to Tanya.
Thanks, Kyle. I'm live at London Health Science Center, where representative of Public Relations Vice President Emily Shushko has agreed to discuss with me the case of Baby Joseph.
Thanks for having me, Tanya.
We're here today because it's my understanding that several tests have been performed on Baby Joseph, and it's the hospital's decision and the case that Baby Joseph is in a persistent vegetative state.
That is true. Repeated neurological assessments have been performed, including MRIs and EEGs. The doctors are standing by their diagnosis of Joseph's vegetative state. At this time, Joseph is still requiring a ventilator and feeding tube to maintain life.
I understand that they think that Baby Joseph has no chance of recovering, that Baby Joseph has no sensation of what's going on around him. Is this true?
Well, the doctors are saying that Joseph has been unable to breathe spontaneously during many attempts, and the movement that people are seeing is not purposeful but reflexes.
Is it true that Baby Joseph's parents want the tracheostomy to be performed so they can take him home, not so he can get better?
This is true, but doctors at London Health Sciences Center believe that the tracheostomy procedure is too invasive and places Joseph at risk for serious infections and even death. They recommend Joseph receive palliative care only due to his unfortunate fatal medical condition.
It's my understanding that the family is in disagreement with London Health Science Center decision, and they're advocating for Baby Joseph to have this procedure placed. What is your response to that?
The hospital has turned to the Consent and Capacity Board of Ontario on whether or not Joseph's parents are complying with the principles for substitute decision-making under Ontario's Care Consent Act in refusing to consent to the proposed treatment plan. Joseph is clearly unable to represent himself in this situation, and further assistance is needed to conclude this ethical dilemma. The board is made up of not only physicians, but lawyers and members of the general public. The board has released this following statement. In this matter, the parents are adamant that they want Joseph to live by any artificial means, in the hope that there will be recovery. However, they know that Joseph will not recover, as expressed by all treating physicians at the center. We agree with the expert advice. There is no hope that Joseph will have any recovery. He has absolutely no hope or chance of ever recovering. While we feel a great deal of empathy for the parents, we agree that their view is not in any way realistic. Joseph's parents are blinded by their obvious love for him and cannot view his situation objectively, nor are they able to put themselves into his position. After 3 months in hospitals, hooked up to tubes and machines, after suffering from the invasion of personal privacy, after suffering human indignities, and with the exacerbated difficulties that would arise because of the tracheostomy, it is time for the parents to say enough. In our minds, there is no disputing the clear and compelling evidence from the doctors. We agree that Joseph should be allowed to die with dignity and that the treatment in his best interests would be removal of the endotracheal tube without replacement, a DNR order, and palliative care.
It's my understanding that the Canadian Ontario Supreme Court of Justice is upholding the decision of the Consent and Capacity Board. Do you think that this is in baby Joseph's best interest?
Well, Canada's response to his best interests are that Joseph has been appointed his own lawyer by the board, and they also released this statement. The parents have their own views, opinions, values, and beliefs. Prolonging Joseph's life serves them and their needs, but what is the best for Joseph? He doesn't have values or beliefs. He cannot think. He is a baby, and for all those reasons, he needs and deserves to have his parents make decisions that put his best interests ahead of their own. I do not believe that they are assessing what is in his best interests. If they were, I believe the result would be different and their decisions would align with the hospitals.
Baby Joseph's parents continue to fight the Canadian Supreme Court Justice ruling. Back to you, Kyle, for more updates on this case.
After a bitter legal fight, a Canadian hospital now is allowing the family of a dying baby boy to take their son home. But the hospital is insisting on following a court order to remove the breathing tube that keeps baby Joseph alive. Last week, we spoke to baby Joseph's father.
The treatment in London hospital let him die. That's the doctor what he said. That's the best treatment. I don't know what kind of treatment that.
Kyle Jones, 8 on your side. We're live in Richmond, Virginia to bring you new updates on the baby Joseph case, the Canadian infant whose life-sustaining health care was court-ordered to be removed. After a long legal fight, the child was sent to a hospital in St. Louis to receive the procedure that would allow him to die at home. Let's send it over to our correspondent in St. Louis for the latest on the case. Chris?
Thanks, Kyle. What a story this has been. I'm live here outside SSM Cardinal Glennon Children's Medical Center here in St. Louis, awaiting a press conference to begin shortly. Following a thorough exam by a multidisciplinary medical team consisting of SSM Cardinal Glennon staff as well as St. Louis University School of Medicine, in addition to extensive consultations with baby Joseph's family, parents, as well as the ethics committee of the hospital, it has been concluded that the tracheostomy was medically appropriate. I've had the opportunity to discuss this amongst colleagues in addition to community members here live. And it is very evident that some people approve the tracheostomy while others downright disapprove of it. Let's listen in live. The press conference begins now.
Good morning, colleagues and guests. I am honored to speak on behalf of everyone here at SSM Cardinal Glennon Children's Medical Center. It has truly been an honor knowing that our facility could help bring this terminally ill child home to his family. Our medical center is ranked nationally in 3 pediatric specialties, and we are a 176-bed hospital performing 2,000 annual inpatient and 6,000 outpatient pediatric surgeries. Joseph's journey would not have been possible without multiple pro-life organizations such as the Priests for Life, the Terry Schiavo Life and Hope Network, and the American Center for Law and Justice. Transportation was made possible by the Priests for Life, who secured a jet in order to fly the family from Canada to an American hospital. In March of 2011, the Priests for Life were able to secure a transfer to our facility and that announced that they would fully pay for Joseph's medical care. We cannot thank them enough. March 21st of 2011 became one of the happiest days for Joseph's family. Joseph received his tracheostomy at our hospital, where he remained here for 7 to 10 days after the procedure was performed. During his stay here, doctors eventually diagnosed Joseph with a rare neurometabolic disorder which causes the degeneration of the central nervous system. Interesting enough, the disease is usually inherited, but no genetic link was found when Joseph's parents were tested. In fact, Joseph's older sister passed away from the same disease. However, she did go home with a tracheostomy. Our medical staff performed multiple thorough examinations with multiple specialists on board, as well as multidisciplinary teams. We also heavily involved Joseph's parents with our ethics committee, and our findings concluded that a tracheostomy was deemed medically appropriate for this child. The placement of the tracheostomy allowed for a stable airway, motility and comfort, and protection for his lungs. Not only that, Joseph was able to go home and live his life in a more comfortable and familiar environment, which is what I would hope every parent would want for their child. You have to ask yourself, if this were your child, wouldn't you prefer them to go home and live their life? There are so many endless questions to think about here. Our hope was that the tracheostomy would allow baby Joseph and his family the gift of a few more months together in the comfort of their own home. I will leave you with this quote from Joseph's father that was said before the family returned back to Canada. He said, "I made a promise to my son. I will give you back your human rights if you pass away or if you don't. Fly and tell God about what happened to you and the doctor that tried to kill you. Your life touched the world." Thank you for your time today. SSM Cardinal Glennon Children's Medical Center will be forever known as Joseph's Angels.
Our thoughts and prayers are with baby Joseph, his family, and all those who cared for him here. I believe we have footage coming in live. Baby Joseph is heading back to Canada, home, to live his remaining days. He is alongside a multitude of medical professionals. Let's take a look. And there you have it. Chris Carter reporting live outside of SSM Cardinal Glennon Children's Medical Center. 8 on your side. Back to you, Kyle.
Thank you, Chris. Seeing Joseph leave that hospital, alive and breathing on his own, on his way back home, makes me wonder why the Canadian health professionals wouldn't perform the tracheostomy. What was the big issue? It seems like the procedure has increased Joseph's life and allowed him to return home. Kyle Jones, 8 on your side. This just in concerning the case of baby Joseph. Joseph has died peacefully in his sleep at the age of 20 months. After many months of debate and fighting, his mother and father were able to be by his side during his last months of life. This is Kyle Jones with 8 on your side. In light of the recent news of baby Joseph's passing, I was able to sit down with Dr. Ann Hamrick, a leader who has written extensively in the field of ethics and has taught courses in advanced practice nursing, role development, and ethics. She is the recipient of numerous nursing awards and has been involved in several nursing organizations at the national level. Dr. Hamrick is the former co-chair of the Bioethics Expert Panel of the American Academy of Nursing. She was an invited participant on the National Consensus Panel to develop ethical guidelines for research with persons at the end of life. And lastly, she was an advisor to the Affinity Group for Nursing of the American Society of Bioethics and Humanities in 2006 and 2007. And with that, let's hear from Dr. Hamrick.
Thanks, Kyle. I've written extensively about ethical dilemmas and moral distress over the course of my career. We've been researching moral distress and its causes long before we had a name for it. Many people are unfamiliar with moral distress, but it is a phenomenon that occurs when an individual's moral integrity is seriously compromised. This happens when one is unable to act in accordance with their core values and primary principal beliefs, obligations, or their attempted actions fail to achieve the desired outcome. Consider the staff at London Health Science Center. They were receiving death threats from the public at large for being involved in baby Joseph's care. A lot of my research conducted in NICUs and PICUs around the world have found that healthcare workers on the front line want to save their patient. They want to provide the best care with the best outcomes in the best interest of their patients. They represent the nursing profession and their core principal beliefs and values such as beneficence, non-maleficence, and justice. Think about baby Joseph parents. They want what's best for their child. They feel as if they are fighting to save their child's life. The moral distress and the ethical dilemmas of this case can cause us all to wonder what is right, what is just, and what should be done. Moral distress in healthcare workers often occurs when the patient is seen as suffering. They question the benefit of aggressive care, the quality of life, and the cost of such aggressive and expensive treatment. Healthcare professionals have told me that they have missed the window of opportunity to withdraw care. Others have said to me, we must tread carefully here because society mandates that we treat compromised infants aggressively. We can't have anyone thinking that we're killing the baby. On the other hand, you have baby Joseph's parents. They want him to live as long as possible. They have strong religious beliefs and they lean on those values when making their decisions. They want to let baby Joseph die when God says so. Who's to say what's right or wrong? Who's to say whose choice it is to make? When we look at the London healthcare system, in the case of baby Joseph, the tracheostomy would not prolong his life. It is not life-saving. They think it would cause more harm than benefit. They're adhering to the principle non-maleficence, that is, thou shalt do no harm. Now, the parents are seeking services from the United States. They're coming to the United States because we value the rights of individuals and their freedom to make the right choice. I have to tell you, this is an end-of-life issue. The problem is this ethical dilemma. Who gets to say how baby Joseph will die, where he should die? Because no one knows for certain when he will die. I want to ask you too, in the future, how can we better equip ourselves to prevent this ethical dilemma from occurring again? Thank you.
Thank you again, Dr. Hamrick, for sitting down with us to provide your expertise and shed light on the topic. We are also fortunate to have with us another expert guest, Dr. Crystal Arbogast, founder and director of Ethical Expert Limited, an ethical trade and sustainable supply chain consultancy which believes in practical and commercially based approaches to improving healthcare across international supply chains. She has 20 years experience across the healthcare community and was appointed to the National Ethics Review Board by President Barack Obama. Dr. Arbogast, thank you for joining us. What's your position on this controversy and end-of-life ethical concerns?
Thank you, Kyle. Moral distress is directly related to the dilemma of end-of-life decisions in care of these patients. End-of-life discussions are not easy for any parties involved, which includes the physicians, the staff caring for them, the family, and then the dying patient themselves. The discussion and decision is even more difficult for families when the dying is a child or a family member with no advance directive or an advance directive that coincides with the family's own beliefs. This affects the patient's autonomy by not letting the patient have a voice in the care when they're no longer able to make their own decisions. When it comes to a child, you have an innate want to do everything possible to prevent the death of a child, even when you know or feel that no matter what you do, the end will be the same, which affects the basic ethical principles of beneficence and non-maleficence. Doing no harm is ingrained in our training, but continuing care may actually be doing harm, and doing no care but hospice may be the right decision in these cases. The greater difficulty comes with the care provider's feelings and beliefs and ethics are coinciding those of the parents and guardians.
I understand. Can you elaborate a little bit more on Baby Joseph's case specifically?
Yes. In the case of Baby Joseph and so many others like him, the family knew and understood the child was dying, but wanted a peaceful death at home, and the physicians in Canada were refusing to let the parents have that, imposing on their right for autonomy and non-maleficence. In Canada, it's a socialist form of healthcare which follows the utilitarianism theory of ethics, which encompasses doing the most good for the greatest number of people while avoiding harm. In Baby Joseph's situation, the parents wanted a permanent airway place so he could go home and die peacefully in their arms around his loved ones, but Canada refused and stated that the money would have been allocated for that one surgery would have taken money and resources away from others to do more good for more people. The family disagreed, and they contacted Priests for Life in the United States, and they made it possible for the family and Joseph to come here to have their wishes followed. The United States follows more of a Kantian approach for ethics, which enforces the intentions of an act and not the consequences, focusing more on humanity and what should be considered right versus doing the most good to the larger group. The family was able to have their wishes met, and their son was able to die peacefully at home in their arms. The difficulty in caring for patients and end of life for a care provider is based off their virtue ethics, which is where their care is based off of our ethical beliefs of what is morally and legally right. If care providers are forced to provide care they are ethically against, moral distress starts to take effect and will lead into residue if their ethics are continually violated.
Wow. Thank you, Dr. Arbogast. That was very informative. There is obviously so much to consider on issues like this. This is Kyle Jones reporting live, 8 on your side. And we're back live. I'm outside of the VCU School of Nursing. After hearing from two leaders in ethics, I'm left wondering if the Canadian decision was unethical and if the parents really were just seeking the best for their child. I'm here at the VCU School of Nursing to talk to the future leaders in healthcare to get their opinion on this controversial subject. Let's go inside.